Acute HIV infection. Weeks 0 to 12. During acute infection, rapid viral replication leads to a massive spike in plasma HIV RNA. CD4 T-cell counts drop sharply before cytotoxic T lymphocytes mount an initial immune response. Clinical latency, chronic HIV. Years 1 to 8. In the clinical latency phase, the virus replicates at lower levels. CD4 cell counts gradually decline over several years, while viral load slowly rises due to persistent immune activation and exhaustion. Acquired immunodeficiency syndrome, AIDS. CD4 count less than 200 cells/L. Without treatment, CD4 counts fall below 200 cells per microliter, crossing the clinical threshold for AIDS. Cell-mediated immunity collapses, exposing the body to opportunistic infections.